Developing tonight, solving the staffing shortage that's been taxing local hospitals. Workers on all levels, from nurses to hospital leaders, agree it's time to make a change. Alma McCarty found out they're now bringing their concerns to Salem.
Friday afternoon outside Providence, Oregon headquarters. Nurses line up with signs rallying support. The union calling for strong contracts for frontline workers within the Providence system.
Wyoming Falls and St. Vincent, we just bargained last year. We won very strong contracts we were really happy with. So we're really hoping that our sister hospitals can, do the same.
The group also advocating for all nurses, pushing for what they call safe staffing at all hospitals. Virginia Smith is a board member with the Oregon Nurses Association.
Ultimately, it helps all of Oregonians to have, nurses at the bedside that are trained, that are well taken care of, that get their rest and meal breaks, and that have enough help to actually do their jobs.
Over the past 3 years, they've been especially stretched thin, with more patients than ever before.
We were all just kind of holding our breath and really trying to kind of hold still just to see what was going to happen next. And now, with the decrease in overall health of our total communities, we're seeing people that are sicker and sicker walking through our doors.
Pretty dire conditions. All of us are a little tired and overwhelmed, exhausted.
It's no surprise to anyone here that so many have left the bedside. Deborah Williston, who's been a nurse for more than 20 years, says it's time for a change.
Most corporate medicine, in my opinion, including Providence, talks about patient-centered care. And that's what we needed to get back to. And we needed to get back to supporting the people who provide that.
Providence sent a statement to KGW writing in part, "We take staffing extremely seriously and are working hard to attract new nurses and retain our current valued caregivers through market competitive compensation and benefits." The hospital system also noting the nursing shortage is a national and global problem. A problem the state's hospital association is also working to fix.
The long-term solution to our workforce challenges are to grow the healthcare workforce. At this point in time, we simply don't have enough available staff to hire.
Both groups are calling on the Oregon legislature to take action this session, presenting agendas specifically aimed at recruiting and retaining nurses, incentivizing nursing educators, and stabilizing hospital systems.
The bills we have proposed are not the full scope of changes we may be contemplating. We need to engage in a collaborative process with stakeholders to come up with a bill that works for employees but continues to protect patients' access to care.
Now, while the nurses and hospital administrators agree on most of the bills expected this session, there is some debate over House Bill 2697. ONA is advocating for this piece of legislation, which establishes minimum standards for nursing staffing and imposes penalties on hospitals for a failure to adopt that plan. The Oregon Association of Hospitals says it's concerned the bill could cause hospitals to shut down beds if they can't hire enough staff to meet the ratios laid out in the bill. Brittany?
Wow, it's an issue that really makes you think as a potential patient in the future. Alma, thank you.